Hi, hello, welcome back to my channel. This is Motherhood Journey with Esther. So today I want us to talk about an important which topic like stages of pregnancy. Um, I hope you will enjoy this LS and as we talk about stages of pregnancy. So I want people to come online, kindly come online so we can talk about stages of so we can discuss about stages of pregnancy. Yeah, I let me use this medium to say thank you to all my subscribers, those that are viewing my videos, those that are watching my videos, those that have been there from day one on this channel. Thank you so much, and I tell you, you would not regret you, and I say you won't regret coming to this channel or joining this channel, and you will be so loving it on this channel, and you'll be so enjoying everything that will be happening on this channel. So today I want us to quickly discuss what motherhood is and stages of pregnancy. As we all know that motherhood is a stage in the time of a woman, that is a stage that every woman have to go through, every woman have to pass through that stage. Is a very beautiful stage, emotional stage, a trying stage, a stage that your strength will be questioned as a woman, and it's a stage that not everyone, you know, is a stage that every woman would want to. Oh, thank you, Senga Fifi. Thank you so much, sis, for coming. I really appreciate you. I didn't see it earlier. Thank you. I to you too. So it's a stage every woman would aspire to be in their life, in their lifetime. So it's a beautiful stage that everyone wants to enjoy. So we'll be talking about stages of pregnancy, like I've said. What is pregnancy at first? Pregnancy is a state of nurturing, a state of carrying, a state of caring for a baby. That is a baby that is in there, a baby that you nurture in your womb. I'm trying to see if I can share it out. So if we can see people to join, because the more persons that join, the more questions we can actually attend to. So stage, like I said, pregnancy is like a period. It is described like a period whereby fetus begin to develop, grow in a woman's womb. I mean, their uterus. A layman call it womb, and we call it uterus, whereby the baby begins to get matured and grow to maturity. When we say a fetus is matured, is when the fetus is 40 weeks. That is 40 weeks pregnancy. That is a full maturity or a full grown baby. Yeah, I know you get that. So today we'll be talking about pregnancies. On this video, I've talked about signs and symptoms of pregnancy, what you can do to achieve early pregnancy, and how you can help yourself during pregnancy, the do's and don'ts in pregnancy, the food you have to avoid during pregnancy. So today, like I said, I'm talking about pregnancy, and what are we going to talk about pregnancy? We are talking about stages of pregnancy. Stages of pregnancy. Yeah, Senga Fifi, thank you so much. Thank you. You are so wonderful. You are adorable. Thank you so much. You don't know, I really appreciate what your present today. Thank you. So, like I said, we're talking about stages of pregnancy. So, like I said in my previous video, I've talked about signs and symptoms of pregnancy, like tenderness, breast tenderness, swollen and tender breast, nausea and vomiting, nausea with or without vomiting. I talked about increased urination, fatigue, headache, slight abdominal pain, and sometimes your missed period will also is a sign that you are pregnant. And a lot have discussed and talked about what the signs and symptoms of pregnancy. So let me quickly brief this. I know everyone knows this, but let me quickly brief that. That how to achieve pregnancy is when a sperm meets the egg of a woman, which is known as the ovary. When an egg is being released from the ovary, which is known as the oocyte, is being released. Then when the sperm, a viable sperm, meets the egg, then there's something we call fertilization. It's like when something like this is the egg and the sperm come in and they meet each other, and their meeting is what is termed as fertilization. And when they meet, there is a life that is being brought to stay, which is a fetus is being formed from the fetus begin to form, and there will be cells duplication, and there'll be the cells will begin to multiply. As they multiply, they divide. As they multiply, they divide. And that is why there are some cells that builds the eyes, the brain, the nostrils, the mouth, the tongue, the tooth, the back, spinal cord, and all and all. Yeah. Thank you, Senga Fifi. Thank you so much. So today we'll be talking about stages of pregnancy. We have three stages of pregnancy. The first stage is the first trimester. We have the second trimester, and there's the third trimester. Let me check if I have a question. So some school of thought says we have four stages of pregnancy: the first trimester, the second trimester, the third trimester, then the post delivery, which is the first, like the stages. If we are divided into stages, labor, delivery, then why postpartum is after the delivery, like five stages. All and all, how you want to divide it is your choice. But now I'll be talking about normal stages of pregnancy. The normal stages of pregnancy is from first week of pregnancy to the 12th week. That is from zero, like from day 1 to 3 months. That is the first trimester. This day 1 to 0, you'll be feeling, you are feeling pregnant, like you know you are pregnant after the positive text. You are feeling that you are pregnant. But at the long run, if you how am I going to put this? You might not like see your tummy protruding. You know, though there are different persons, immediately they are pregnant. It's not like immediately you start seeing your tummy coming out, but you know there will be a slight change. Like you know something is you have carried something, like you are carrying something. But some persons started increasing in size. You see that you just detect that your normal clothing are not actually entering you. And if you check yourself, you see that it's not like you have really people that are outside, they might not really notice that something is happening, but you yourself entering some of your clothes, you see that they are not really shaping in right, you know. So that is the first stage of pregnancy. That is the stage you experience nausea and vomiting. You can experience headache, tiredness, fatigue, loss of appetite, or eating excessively, insomnia. Why some people sleep a lot. A lot of things happen during this stages. Why second stage is stage 13th weeks to 28th week. That is the second trimester. Thank you, Fifi. Thank you so much. I really appreciate that. Is the second trimester, which is from week 13 to week 28. So at this stage, you know, there are a lot of things that come to place. That you experience quickening at 16th week. Quickening is when the baby kicks you. That's the first, when you enjoy the first kicking of the baby. It is called quickening. So during this second stage of pregnancy, which is the second trimester, you experience what is called quickening. You experience your breast begins to get bigger, you know. Yeah, and then your tummy begins to come out slightly. People can notice, people around you can notice that, oh, this person is carrying something beautiful. Something beautiful is about to show up. So that is the second stage of pregnancy. And at the second stage, there are a lot of things you have to into consideration. Maybe informing anyone, friend or around, about your expecting themselves, that you be expecting. At this stage, also you can also baby to know who either it's a boy or a girl, and you can also leave it till the delivery day. And at this stage, also you can start planning. Immediately you know the sex of your babies, you can start planning for shopping, getting some things you think you'll be needing, like breastfeeding pillow, and all stuff of things you want to really get. So during the first trimester, you can take any position you want to sleep with. You can sleep in any position, and you can have XCS anyhow, even the missionary style anyhow. But the second trimester, you need to maintain sleeping by your left side. You can't sleep by your back again, and you can't sleep. Um, some persons will feel uncomfortable sleeping with their tummy. So by this time, the best way you can sleep is sleeping by your left side, because it aids um oxygenation of the baby. It aids the baby to breathe fine and well. And it's also it's a comfort. You can also get a sleeping pillow for yourself, and a sleeping there's something that is made with pillow, like what is it called? How am I gonna put it? So if you can shop it to get there's a way you can place it between your two legs, and you can actually your tummy your bump can also rest on the supporting pillow, and you can sleep well and nice. So this second stage of pregnancy, like sorry, I forgot to mention this. At the first stage of your pregnancy, immediately you detect that you are pregnant, you really need to go to the hospital for antenatal care and visits. The first stage of pregnancy, um, you need you need some multivites, like some folic acid, vitamin B core, and some other essential multivites that helps to prevent neural tube defect and some other abnormalities in your baby and for yourself to live fine and to be okay. So I'm very sure you'll be familiar with your midwife and your health practitioners during the second stage of pregnancy. So at the second stage of pregnancy, you can also start talking about the scan, checking if the well-being of the baby and all, and the sex, like I've mentioned. Why the third trimester is from week 29th to 40 week. Thank you, Senga Fifi. Week 29th to 40th week. That is the what is it called? The third stage of pregnancy. So at this third stage, you need to plan your delivery plan. Like, you need to plan how you want your baby to come. Is it through cesarean section, or you want to birth your baby by yourself, or you want some assisted birth techniques, like water bathing, or like, what am I gonna say, like cesarean section, like giving an injection. There's something we called this just skip my mind, but is they give injection at your a part in your spinal cord that will help to numb the abdominal and your two legs. That is, you won't actually feel the pain of labor during that period and that time. And you can actually, when the head is closed, then the nurses and midwife take close monitoring on you to actually know when you are full, and you can actually bear down all by yourself. So there are different beds support mechanism that your health practitioner will let you know, and you can actually decide if you want home delivery. Actually, there are some things that you need to consider when planning for home delivery. You must not be a primate. What do I mean by primate? That is a first timer mom. They won't allow you to go for home delivery sometimes in some country, because they know that first timer comes with a lot of things. So they would actually want to put you in an health facility that, in case of in case it's anything that comes up, you'll be well taken care of. So that is the third trimester, which ends at 40 weeks. That is the full-term baby. Let me now say, and like I said, there's some school of thought say that the fourth stage of pregnancy is the labor, where you start feeling consistent contraction. I talked about quickening, I talked about during your second stage also you started feeling some slight contraction. It is known as forced labor, and the medical terms is Braston's contraction. Is a contraction, but it's a mild contraction that can't lead to labor. While the original labor is a labor that when you feel the contraction and the tightening, it comes consistently, like it won't stop. It will stop for some minutes, it will come again, it becomes strengthened. And this Brussels contraction, you can feel it now, and for the in the next 4 5 hours, you might not even feel it again. But when it is real contraction, you feel it will stop for some minutes. It comes again like that till it gets strengthened till it helps to push down the baby. So that is the first stage of labor. Why the fifth stage of labor? Is when the baby is out, the head of the baby is out, then your baby is out, then the placenta too is being delivered, then there's control of bleeding, there's no bleeding, mother and baby is fine. And that is when we move to the postpartum. That is where we call postpartum delivery. So after the delivery, we ensure that the mother and the baby is fine. So these are the normal stages of pregnancy that we have, and I hope this has enlightened you a little bit about the stages of pregnancy. I think I'm going to end this live stream here now, and I'm going to start another one to talk about miscarriages. It's a big thing we have to discuss. A lot of persons a lot of persons have how am I going to put it? A lot of persons are experiencing these miscarriages and don't know what on or how to go about it and how to help themselves out of this. So um so we'll be talking about miscarriage the next life I'll be doing. So please, if you have any question or any clarification, kindly drop that at the comment section. I'm going to attend to it and I'm going to talk about it soon. I hope you enjoyed this video. If you like, please give this video a thumbs up, kindly share with family and friends, and do not forget, you will not regret joining this channel, because this channel, it's on this channel you're going to be enjoying a lot, and you're going to be loving everything that will be coming up on this channel. Thank you for those that have joined. Thank you, Senga Fifi. Thank you so much. Thank you so much. I hope you're going to come to the second live I'll be doing shortly. I'm just going to end this so it won't be too long, so I can start the second one. I hope you also join me. Thank you so much. I really appreciate it. Bye.